Hello folks, Emily the Pharmacist Witch here. In this video, I'm going to talk through my suggestions for a question that I guess get asked often. And that question is, how do I know what to do to move forward with my health? Whether that's traditional medicine or alternative or Eastern medicine. And I'll preface this by saying there's no one right answer. So if you feel like you're looking for a needle in a haystack, rest assured that's not the case. There's no one right answer. And then the second thing I'll say to preface this video is every body is different. Every mind is different. And so what works for one person might be different than what works for someone else. So I'm not going to say, there's one fit for every single person. It's just, in my experience, I've found that's not the case. But what I'll propose here is some suggestions for navigating your own journey. The first thing that I recommend is try to figure out what exactly it is that you want for your health. And try to be as specific as you can be. Even write it down and be complete, right? You might say, I want to be pain-free on 5 out of 7 days a week by, 2 months from this date. I want to be off of 2 of my medications by such and such date. I want to sleep 8 hours every night for, 2 weeks in a row. Whatever it is, be as specific as you can be. Write it all down. And there are several reasons this is helpful. The first being when we are intentional about what we want, when we can really be clear on what we're looking for, we activate the reticular activating system of our brain. And this is, I like to compare this to the Google search function. So when you're telling your brain to look out for these things, right, you have these intentions, these goals, your brain is going to work with you to help you bring that about. You're going to be keyed in to possible solutions, possible ways to bring about that goal. It's sort of like, when you tell your kid, let's count all the red cars, your kid's going to find all of those red cars, and so will you, but you're not going to notice the blue cars at all. Right? You keyed your brain in to notice something specific. So that's the first reason. It's really valuable to just write down what you want for your health. And then, the other reason this is useful is you can bring these goals with you to whatever provider you plan to meet, whether that's, again, a traditional medical doctor or nurse practitioner or someone in the alternative wellness space, right? This is sort of a map for you and whoever it is that you want on your team to help get you where you want to go. And it also helps you track your progress, right? If you decide, I want to be pain-free 5 out of 7 days a week by such and such date, well, by that date, you can look back and say, did we meet our goal or not? And if not, then it's helpful for you to, find a new plan or find a new way to go about achieving your goal. So there's, I'll do another video a little bit later this week on, setting goals in this way. But for now, just write down everything that you want, be as specific as you can, even challenge yourself to set a particular number. Maybe I'm going to write down 20 things that I really want for my health. And I'd say too, as you're doing this, try to frame it in the positive, right? So instead of saying something like, I don't want to experience pain, say, I want to be comfortable, free of pain by such and such date. So it's, we're framing it in the positive as often as we can. The second thing I recommend for all folks who are kind of figuring out how to move forward in their wellness and health journey is be prepared to invest in your health. And investing can look like a lot of different things. We can, it's really investing energy, and energy can look like your time. It can look like money. It can look like your attention. There are lots of different currencies that we can exchange for the health that we want. I'll say, one of my biggest fears when I was a clinical pharmacist, I would have folks come in who would tell me, I don't want to take medications anymore. And I would say, okay, that's a goal, but then they wouldn't want to make any investments other than, they wouldn't want to make any investments at all. They weren't open to, using their time or their resources or anything to kind of help themselves. So it's a tricky spot for any provider to be in if you're personally not willing to make an investment in your health. Because if you're dealing with an illness of some sort, it demonstrates an energetic deficit, right? We need to put in energy to correct the deficit if we're going to get better. And this is also true for maintenance. Unfortunately, I suppose our bodies need regular maintenance, and that takes energy too. So be ready, whatever your goals are, be ready to invest something into it. And I would say here, as you're thinking about how you'll invest, try to frame that investment as love for your body, for your mind, for your health, for your life, right? I think, I've seen folks whose investments are not coming from a place of love. I have a friend who's working at a med spa where a lot of clients are coming in for like liposuction procedures. And she's found that a lot of folks who have these procedures, right, they've invested a lot of money in it. They're just not happy with the results at the end. And I think if you're going into your health goals and it's coming from a place of like hating your body or not appreciating your body, I think there's a chance that you may be disappointed, whatever it is that happens. So if you can try to find the motivation as love, then whatever it is you decide, whatever energy you decide to invest, it's just going to be that much more satisfying at the other end. And just to give you some examples of ways that you might invest, for me, I found books, investing my time in reading books, to be one of the most helpful things in my own health journey. I met with a therapist. She's wonderful, and that experience was valuable. But I will say the books that she recommended were maybe even more powerful for me personally. That's just, that investment of time, it paid out for me. But whether it's time reading or time finding YouTube videos, there are lots of money-free ways that you can invest your energy into your health, and food too, right? We all have to eat. So if that's something that you think would be helpful for you, learning about particular foods that might be helpful, something you have to do already. So thinking about that can be helpful. Yeah, and certainly there's money, right? There might be providers that are more expensive, but because you're approaching it from a place of love, you feel like that money will be spent, well spent, and you'll have the outcome at the end that you're desiring. So lots of different options in terms of investment, but I will say, be ready to invest. I think, another important one, where to start, right? How do you know where to start? And I'll say our intuition, our kind of like gut feeling, is the most powerful compass that we have. If you hear someone talking about something, if you read something, if someone suggests something to you, and you have a gut reaction that tells you, oh, I want to learn more about that, that's valuable, right? Your gut is powerful. And then to kick it up a notch, if you have coherence between that intuition and your good judgmental brain, we are on the right track. If something appeals both to your sense of judgment and to your gut, to your intuition, you're already setting yourself up for success. I like to think about this in terms of the placebo effect, right? So in clinical trials we'll talk about clinical trials for drugs, there are always people who respond to the placebo, to the sugar pill, to the non-active ingredient. Always. There are always people who respond to this. So why is that? I like to think, I don't have proof for this, but I like to think that people who respond to placebos are already coming into the situation with some confidence. They're already kind of primed mentally to believe the drug is going to work. They already perhaps feel that it's going to work. Maybe they developed a strong relationship with a provider in the trial who is administering the medication, and that sense of compassion, that sense of like feeling good about it, plus, believing from a scientific standpoint that it's going to work, perhaps that coherence is what helped them have a response when there was no active drug component. I like to think about that. So all of this is to say your mind and gut are incredibly powerful allies for you. And if you find something that appeals to both, pursue that. Learn more about that. And then I would say perhaps you've decided on a particular route. Maybe that is a traditional medical doctor. Maybe that is, an energy healer. Maybe it is a homeopath. There are infinite possibilities that might appeal to you, that might spark that coherence between your mind and your intuition. So once you've decided on a route and you're choosing a provider, I think first know that you don't have to go with, you can experiment, right? You're allowed to find someone that feels right to you. You don't have to just, go with someone because that was the person you chose first, right? You're allowed to experiment, you're allowed to change your mind. And I'd say as you're navigating these relationships with providers, keep a couple of things in mind. I would say, is this provider telling you that their way is the end all be all? Are they saying like, you have to do it my way, this is the only way forward? I would be a little bit skeptical of that, right? If it feels right to you, that's fine, that's great. That matters the most, right? How it feels to you. But I would say maybe approach that type of provider with caution, because I do think that there's no one right answer. We are a whole spectrum of folks. So bear that in mind. I would say the provider you've chosen, are they asking you what you want? And if they're not asking you what you want, are they open to you sharing what you want? This is your body. This is your health. This is your life. You have agency here. You have choice here. And your provider is a team member. They are not a god, right? They are not here to make all of the decisions for you. If you want that, that's cool too, right? You can choose that, but you don't have to, right? You can have your provider be a team member who's there to educate you, to support you, to guide you. And so, I think it's important in those collaborative relationships that this provider is willing to hear your goals, right? That you spent some time writing down before you saw them. So, and also I would say if you have a provider who's not asking you what you want or not open to hearing it, you can advocate for yourself. If there are other things about this provider that you believe in and you want to try to make this relationship work, you can tell your provider, hey, this relationship is going to be a lot more helpful for me if you're open to hearing X, Y, and Z, what I want. I am looking for a provider who is open to collaborating with me. For most providers, you're going to make their day when you say that. Speaking from personal experience, so many years I felt like I had to be the one to fix it all. I had to be the one to find all of the solutions for folks. When I had patients come in and say, hey, I've got my piece of this. I know what I want. What I need is your help doing X, Y, Z. Oh my gosh, music to my ears. We can be teammates and I don't have to have all of the answers for you because I'm not you, right? I'm not you as your provider. So you're allowed to ask for what you want in the relationship. That's okay. Whatever it is that you want, you're allowed to ask for it. I would also ask your provider, whatever it is that they're sharing with you, their methodology, again, whether it's traditional medicine or something in the alternative wellness space, what they're selling, right? Has it worked for them personally? I think this is really important for providers to have integrity, to believe in what they are sharing. I found, for me, I was able to form connections so much stronger with folks when I really believed in what I was pitching. And for me, in the end, a lot of that ended up being, moving the physical body, loving your home in this world, your body. And so, again, don't be afraid to ask your provider, why did you get into this particular space? What is it that drew you to this form of wellness, this form of healthcare? What does this look like for you? And they might not want to share. That's okay. But A provider who has a lot of confidence in what it is that they're selling is probably going to be willing to share a little bit about their own journey. So don't be afraid to ask. I think a lot of us as providers are hesitant to push anything on anyone that's worked for us. We don't want people to feel like they have to do what we do. But if you are asking your provider, hey, what worked for you? They're going to, I think 9 times out of 10, they're going to want to share because they found some success in it too. The other thing I would say in navigating a relationship with a provider is, are they using fear as a motivator? I find for me and for a lot of my patients, this is an unhelpful tool. I was talking to my friend the other day who had her first visit with a chiropractor, and they did some x-rays, and the nature of the visit, she called me afterwards in a panic because her chiropractor had said, oh, all of this is so wrong with your spine, all of this is so bad, and unless you come and see me 2 times a week, every week, forever, you're going to have, spinal cord injuries and blah, 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 blah. And so, she's now scared. She's now feeling paralyzed and unsure of how to move forward. And she's also now feeling a little bit uncertain, like, is this chiropractor, like, do they actually care about me, or are they just trying to sell me on more visits? So, it's something to think about, right? Is your provider doing a good job of balancing education, right? So I think it's important for providers to share what can happen if we're not thoughtful, mindful, investing in our health now. And I tried to do that as a diabetes educator. I tried to say, hey, like, we care about managing the blood sugar. We care about helping you feel strong and well now, because if not, there are potential complications that can occur down the road, right? We can experience, heart failure, we can experience kidney failure, right? So, my approach, I really tried to present it with equanimity. It's not helpful to say, if you don't change right now, you're going to lose your leg. I suppose maybe for some people that is helpful. If it's helpful for you, you can find that. But I found for most people, it was approaching things with, let me educate you, let me share everything I can to keep you safe and protected. And we'll move forward together. So find what feels right to you. I guess, here I am trying to present everything with equanimity. Perhaps fear is a powerful motivator for you. If you know that about yourself, cool. But, if not, try to find a provider who's not making you feel afraid. And I'd also say, in navigating these relationships with providers, do you feel that they have confidence in you? I think we've done studies that show patients do better when they have confidence in their providers. So, subjectively, I mean things like better pain scores, better sleep reported, better just kind of general well-being improvements. So subjectively, we've found that patients do better when they have confidence in their providers. But I suspect that when people feel that their providers have confidence in them, then we have some real magic. When there is a mutual sense of confidence, where you have confidence in your provider, they have confidence in you, I think that is a really strong relationship there. And for a long time, it was something I withheld from my patients. I had put all of my confidence in the pills and the medication. And it took me a while, and it took me until I was kind of already deciding to leave the medical field to unabashedly and without pause give my confidence to the patients in front of me. They didn't have to earn it. They didn't have to prove that they could do X, Y, and Z before they had my confidence. I gave it freely because I have confidence in all people to help ourselves be healthy and whole and well. We have this sense of desire, right? What is it that you really want for your health and your life? And then we are born with the tools to help us get it. We're born with our powerful judgmental brains. We're born with our strong feeling hearts and our powerful bodies. And, I give my confidence freely now. You can do it. You have what you need within you to be healthy and well and to have the life that you want for yourself. So I would say if you can find that in a provider, I think that you're on the right track. And then lastly, as you are trying some things out, as you're following your inner compass and your, the judgment of your mind, and you're meeting some practitioners and providers, try to document your journey, right? Because then you'll know if you're meeting your goals or not. You'll know when it's time perhaps for a new goal. And also it helps for posterity's sake. If you have a similar situation in the future, you can look back and say, oh, I remember I tried this and it was really helpful for me. And also for someone else who might be experiencing the same thing. I think for a lot of us, our health has become something that we don't feel comfortable talking about. But if you can approach your journey from a place of strength, of owning it, of, being okay talking about your struggle, you might find you're able to help someone else in their journey as well. You might also find if you're open to being a little bit vulnerable about what you're going through, you might find someone else has something to offer, some recommendations, some suggestions for things that worked for themselves. I think we can learn a lot from each other, not just from our providers, but from folks that we encounter every day. I was at Market Basket the other day. I was getting a sandwich and someone else was waiting, and he was kind of chatting with someone else in line about how he was making some changes in his diet in the wake of a recent illness. He was suffering from long COVID, and I was kind of eavesdropping and overhearing. And I asked him a little bit more. I was like, I was curious, and he was open to talking about it. And so that little connection, I learned a bit more about long COVID, about what it feels like. And although, I didn't feel like I could help him a lot in that moment, his openness to talk about it, he's going to draw people to him who might have just the ticket to help him feel better. And in fact, as he does feel better, the more he's willing to talk about it, someone else might find some comfort in what he's offering. So I think, just being willing to talk about your journey, coming at it from a place of, curiosity and compassion, it's great. So all of that is my advice for navigating this space. Just to summarize, go in, figure out what you want, write it down or record yourself, figure out, be as specific as you can. Be prepared to invest, whether it's time, spent watching YouTube videos or reading, whether it's money in terms of provider visits, whether it's your attention. Be ready to invest something, some kind of energy, and do it with love. Follow where you have coherence between your mind and your intuition, where you feel your heart and your head are in agreement. Start there in terms of what visit or what book or whatever it is, whatever step you want to take to move forward. As you're finding a provider, keep in mind a few things, right? Are they saying that theirs is the only way? Maybe be a little cautious there. Are they asking you what you want or hearing what you want? That's a valuable thing. Has what they are selling, has it helped themselves? That's really valuable too. Are they using fear, or are they using other approaches that are more balanced, that resonate with you? And then, do you feel that they have confidence in you? Do you have confidence in them? And then lastly, next, document your journey in whatever way feels right to help you see if you're meeting your goals, to help someone else later on, to help yourself later on. Check in writing. And then lastly, if it's comfortable for you to do it, be ready to share your journey. Be willing to share your journey, because you might help someone else and you might hear something from someone else that helps you. So, thanks so much.